All right, we will go ahead and get started. So this was what I intended to, oh, this TV doesn't work. So I'm going to be referencing this TV a lot while I'm talking, and you guys are going to be like, what the heck is he talking about? But those two over there work, okay? So this is the kind of lab lecture that I was intending to give after you guys took your math portion of your test, but that took you longer than what I'd anticipated. So we will do it today. Okay. Today we're going to talk about identifying sick animals, and we'll go over different treatment protocols. This is going to focus primarily on BRD. However, we will go into some other illnesses that are common in the beef cattle industry, in the stalker and backgrounder and finisher phases. So we'll talk about some of that. But this will be some information that you'll need to incorporate in your case study assignment, which we're getting close to where you guys will have all the information that you need to start doing that. So I will start working on getting a rubric and some more defined guidelines put out. And we'll probably give you, I don't know, 3 weeks after, maybe 2 weeks after you have all the information you need to do that case study assignment number 1. Pretty shortly after that, as we get to the feedlot section of the course, we'll go over the material you need to know for this case study 2. It'll be due quicker, right? And then case study 3 is literally you guys just presenting your 2 systems. Okay, so we've got plenty of time. I'm going to give you plenty of time to get it done, so don't worry about that. But we are getting close to where you guys can complete it. Okay. All right. So from today, I want you to know what DART stands for, D-A-R-T. Has anybody heard of that before? Okay, we're going to learn something new. I want you to know what clinical illness scores are. Okay, I want you to understand the difference between bacteriostatic and bactericidal antibiotics. I want you to be able to outline what the good tenets are of a good treatment protocol. Okay, I want you to know the relevant diseases to growing and finishing cattle. And primarily it's going to be BRD, but there's some others, pink eye, Clostridium, things like that. I don't want you to memorize every etiology, okay? But I want you guys to understand the overall, like how the illness occurs. So, for example, Clostridium, they infect the animal, they go to their predilection site, don't even need to know what predilection site is specific for each of the different Clostridia, but there they replicate and they cause their subsequent problems, right? So if I ask you, for example, what is a potential cause of pink eye, right? You'll be able to say face flies, okay? What bacteria is primarily the cause for foot rot? Okay, so it's that Fusobacterium necrophorum. What are 2 feed additives that we can feed to prevent coccidiosis? Right, ionophores and decox. Okay, I want you to be able to define what metaphylaxis is and be able to give the scenario where we want to give metaphylaxis treatment. So these are the things we're going to cover today. Okay, this is a cool resource that Merck has published. It's an app, so you can go follow this link and download it. But it has a bunch of pictures and then descriptions of diseases so that it can help you in the field. You identify disease, you see some clinical signs, you can use this as a reference to diagnose what that illness is. So it's a pretty neat app. If you aren't very squeamish, I recommend downloading it, looking at it. There are some pictures in there that could make some people who don't want to be vets a little lightheaded. Okay. So that's an interesting resource for you guys to check out. All right. So BRD, we've talked about this a little bit. It is the most common and most important health problem seen in beef cattle. Okay. It costs around $2 billion to the beef industry every year. So it's very economically important. So the etiology behind that. Okay. Stressed cattle have a weakened immune system, have weakened resistance. They become susceptible to the virus. So those are the viruses that you guys knew for test one. Okay. That viruses further suppresses immune function and allows bacteria, those bacteria that you guys learned for exam one. So it allows them to infect the lungs and cause abscesses. So importantly, when we give an antibiotic treatment to cattle to treat BRD, are we treating the virus or the bacteria? Who knows? Do antibiotics treat viruses? No. We are treating that secondary inflammation, that secondary infection. Okay. So we provide these antibiotics. They control the secondary bacterial infection until the immune system can cure the disease. All right. The immature immune system of stocker calves is not able to respond to vaccines as well as the immune system of an older calf. Okay, especially if they're stressed. So if we don't get a vaccine in these calves before they leave their home ranch where they were born and raised, right? They're going to be stressed from transportation stress. It's going to suppress immunity. Okay, they're going to have a poorer response to that vaccine. Okay, lighter animals, younger animals have a poorer response to vaccines and are more predisposed to develop that illness. Okay, so we can see that in the Kansas State Focus on Feedlot report. Okay, here on the x-axis we have placement body weight or in weight. Okay, on the y-axis we have death loss. Okay, so about 24% of the variation in closeout death loss is explained by placement body weight. So cattle that are lighter when they're placed in a feedlot or received into a stocker program will have a worse response to vaccination, worse response to stress, and they're going to be more susceptible to develop diseases and have mortality. Okay? Does that make sense? Any questions so far? Okay. All right. So the basic tenets of what makes a successful treatment program. Okay. You want to start treatment early. Okay. What is your procedure for identifying sick cattle? Do you just go out there and go based off vibes? Right. You never want to assume that a sick calf that is left untreated will recover. Okay. So we need to keep animal on treatment long enough for them to fully recover from that infection. Okay. We want to use effective antibiotics that are administered properly and at the proper dose. All these have labels that have been approved by the FDA. If we go off label of what the FDA has approved, we need a written veterinary authorization to do that. If we don't do that, we have adulterated that animal, and theoretically, that animal should not be able to enter the food system. So humans should be able to eat it, right? Okay. You guys will see as we go through this how important it is to keep individual animal records. Okay. And when we are treating cattle, basically all other management, we manage cattle as a group. Whenever we're treating cattle, we are managing the individual. So these records need to be on the individual animal basis. Okay. We need this so that we can track withdrawal times. So the FDA has approved a certain amount of time after an antibiotic has been administered before that animal can be harvested. Okay. If you sell an animal that has not had adequate withdrawal times to a packing plant, they test that meat and it comes back with high residues of antibiotics, and they can trace that back to you, you're going to be in big trouble. And that does happen. Okay. So we also want to know when they are eligible to when they are eligible for subsequent pools. Okay. So what was it, 2 weeks ago? We rolled the dice and you guys got your percent first treatment, second treatment, third treatment, death, right? So whenever I'm talking about treatment pools, We pulled them and treated them once for BRD. We pulled them and treated them twice for BRD. We pulled them and treated them 3 times for BRD. Some protocols will go 4 times. Okay. And then typically these protocols will do either 3 and you're out or 4 and you're out. Okay. And if the animal doesn't recover after the 3rd or 4th treatment, you either need to withdraw them off the antibiotics and realize them or they're going to die. Okay. That's just the fact of the beef industry. I always like to say you can't have livestock without dead stock. Okay. Does that make sense? So, when an animal becomes eligible to be pulled is going to be based off of your treatment protocol. You want this to be kind of very well outlined. So let's say you're a manager and you have 10 different pen writers, right? You want them all to follow that same treatment protocol that you've given, so you're treating all animals kind of the same. Okay. Then we want to change antibiotic class with each subsequent treatment. So we want to try to broaden the spectrum of the antibiotics that we're giving and give more antibiotics a chance to treat whatever illness an animal has. Okay, so we'll go over what I mean by antibiotic class. Okay, DART. You guys need to know this. DART stands for depression, appetite, respiratory signs, and temperature. Okay, so these are the clinical signs that we use to diagnose BRD. Okay. There will be a question on your second exam that says, define the DART acronym. Okay. So, does anyone want to hazard to guess what depression means? Yep. Animal looks like it does not feel very well. Okay. You'll see some real sick animals that start knuckling, right? So as they're walking, they're pretty stiff-legged, and then their ankles will kind of give a weird flexion. So that's called knuckling. Okay, appetite. What do I mean by appetite? They're not coming up to the feed bunk whenever they're being fed. They're hanging in the back of the pasture, not going out and grazing. Okay, sick animals that don't feel well will not eat. Okay, some of them try to be real tricky. Okay, so they may actually go to the feed bunk. They have their head in the feed bunk and head down, but they're trying to blend in with their group. Remember, they're prey animals, herd animals. Their instinct is to try not to stand out. So you'll have some animals that are sick as a dog, walk up to the feed truck, respond just like everybody else, have their head down, and be pretending to eat. Okay. So typically, we're trying to identify cattle that are sick before and after the feed truck arrives. Okay. Respiratory signs. What would I mean by that? Coughing, hard breathing, nasal discharge. Okay. Temperature. High temp. What would be a high temp for beef cattle? Some people will use 103.5. Some people will use 104. Just kind of depends on the protocol. Okay. But you have identified these animals through the DART system as being sick. You've given them a clinical illness score. That clinical illness score means that they're eligible to be treated. You pull them, you do a rectal temperature, check their temp. If they have reached whatever threshold in rectal temperature that you've set for your protocol, they'll be eligible to receive a treatment. That make sense? Okay. The clinical illness scoring system. So I go out and I look at a pen of cattle. I use my DART clinical illness signs to identify animals that are sick. Based off the severity of that illness, of the signs that they're showing me, I will score them 0, which is healthy, through 4, which is moribund. Okay, so moribund means they physically cannot get up and move. They're so sick they can't stand. Okay, so increasing scale from 0 to 4. This I pulled out of Ives and Richardson, published in 2015, where they kind of define what these are. Okay, so one is slightly ill, so they have noticeable depression. Uh, they may not have apparent signs of weakness. Okay, so maybe they have no issue walking. Okay, they may have a little bit of appetite, but maybe they have nasal discharge and some coughing. Okay, moderately ill, so marked depression with moderate signs of weakness without a significant altered gait. So maybe they're standing there head down, hunkered, but when you get them to move, they're kind of walking normal. Okay. 3, so severe depression, signs of weakness such as significantly altered gait. So that's where you're going to start seeing these animals display trouble walking. Okay. And 4, moribund, they're unable to rise. Okay, so they're very sick. Okay, so if I look at this picture from this group of cattle, kind of hard to see here, but which of those is standing out to you as being sick? The one on the right. What's giving you that indication?
The way that it's hanging its head.
Yep.
And it's kind of standing away.
Showing signs of depression. Here comes the circle. Bam. Okay. Zoom in on this animal. Okay, this animal has obvious signs of depression. They have a lack of gut fill. So who knows what I'm talking about when I say gut fill? Yeah. Right front of the hooks on what side? Left side. Why the left side? That's where the rumen is. So you literally look right here in front of the legs. You look for that sunken in triangle. Triangle, like I do no geometry. Okay. If that is sunken in, it's kind of an indication that the animal has not been eating. So therefore it's displaying appetite signs. Okay. Whenever I go and I check a pin for being sick, I walk them in a counterclockwise circle. Why would I want to do counterclockwise? So I can see them from their left side. So I can check for their lack of gut fill. You can also check for bloat, right? Which bloat is going to be displayed on that left side as well, because that's the side the rumen's on. Okay. Make them walk so you can check them for physical signs of weakness. Okay. Stumbling, knuckling. Okay. So appetite. So after feeding, are cattle coming up to the bunk to eat? Okay. So even if they are at the bunk, are they just up there trying to disguise themselves and blend in with the group? Or are they actively eating? Okay. So as I mentioned, cattle are prey animals. Their instinct, even when they're not feeling very well, is to be with the herd and to blend in, right? So some sick cattle will often try to be, just fly under the radar, right? They will disguise themselves within the larger group so that they don't stand out and display that they are easy prey. Does that make sense? So you really have to check, okay, they're at the bunk, are they physically eating? Okay. Respiratory signs. So we've said these: labored breathing, runny nose. Okay. When the animal has a runny nose, make sure it's just not cold that morning, right? And then coughing. Those are pretty self-explanatory. We exhibit the same symptoms for respiratory illness, right? Okay. For this class, we're going to use a threshold of 104. I think I said maybe 103.5. Some other people have used. Some people could use 103.8, right? But we're going to say 104. Again, that's pretty obvious, right? What temperature is. Okay. So based off the clinical signs and based off of the clinical illness score that we give them, we've identified an animal that's eligible to be checked for temperature. Okay. We decide in our protocol what that threshold for an animal being sick is. Okay. Say typically it's 104. Okay. So based on the clinical illness score, is there a threshold where cattle get treated no matter what? Okay, no matter what they temp. You can have cattle that are very sick and they will never reach temp because they're just physically weak, right? So typically I've seen people use a clinical illness score of 3 as that threshold where they will treat that animal no matter what. Okay. So how many strikes until they're out? By that I mean how many times are we going to be pulling these animals and then giving them a treatment? Typically it's 3 to 4. Okay. There becomes a point in time where antibiotics aren't working. There's no point in continuing to doctor that animal. So the cost of these antibiotics are not cheap. These prices I did not update for this year, so I expect they're actually a little more expensive. Okay, but 100 milliliter bottle of Draxxin costs $200. Okay, so that's $2.11 per milliliter. Okay, 500 ml bottle of Draxxin costs $950. So that's $1.90 per mill. Okay, so if I'm going to treat a 600-pound animal, that treatment of Draxxin is going to cost me $13, right around $13, right? So it's not cheap. Okay, then the other thing to consider, how many days between treatment pulls are we going to give these animals until they're eligible to be retreated? I'm going to say typically it's 2 to 5 days. Most that I've participated in are about 5 days. Okay, so we identify an animal sick, we pull them, we treat them with our first antibiotic in our protocol. Okay, then they have 5 days before they're eligible to be pulled and tipped again and then treated with another antibiotic. Okay, if I have an animal that I pull and treat once, 5 days later he's sick, but he does not have a clinical illness score of 3 or greater, 3 or 4, right? And I bring him in and I tip him, he doesn't reach 104, I'm not treating him again. I'm kicking him back out. But I may pull him again the next day and the next day, right? Until he's either a clinical illness score of 3 or he does reach that temperature threshold. Does that make sense? Okay. We need to have this time between pulls so that we can allow the antibiotics that we gave them to be effective. Okay, these things aren't going to cure the illness, or suppress those lung lesions, those abscesses in the lungs, the bacteria that have set up site in the lungs. They're not going to respond to the antibiotic right away. It takes a little bit of time. Okay, any questions? Everybody understand this? Okay. So for your case study 1, you have what percent of your herd was treated 1 time, 2 times, 3 times, 4 times, and what percent died. You're going to develop a treatment protocol, okay, based off of these things, and you're going to calculate your medicine costs for these animals based off of a Google cost of what Draxxin or whatever antibiotic you use is for each treatment. Does that make sense? Okay. All right. These are antimicrobials that are currently approved to control BRD in cattle. I had to move that because I have a table just like this, which is antibiotics that are approved for metaphylaxis. Okay. So we've got Advocin, Baytril, Draxxin, Exceed, Micatil, Nuflor, Zactran, Zaprivo. Okay. They all have a specific dosage. Typically, that's so many mLs per hundredweight. Okay. Then they have a specific route of administration. Most are going to be that we're using, especially in these treatment protocols, are going to be administered sub-Q. So what is sub-Q? Under the skin. Okay, where would you give and injection subcutaneously, according to PQA. In the neck. Why the neck? Yep, there's also typically a lot of loose skin, and if you're using the appropriate needle length, you're less likely to even hit muscle. But if there is an abscess that forms in the neck, it's not going to be that costly to the overall value of the carcass. So, yep, good job. Okay, so some antibiotics are bactericidal, others are bacteriostatic. Know this, bactericidal kill the bacteria. Okay, bacteriostatic inhibit their growth and reproduction. So the spectrum of these antibiotics, which spectrum is range of activity, varies with different drugs. Okay, not one drug treats everything. Some drugs may be more beneficial for Haemophilus somni. Some may be more effective against Pasteurella multicolda, right? Okay. So that's part of the reason why we want to switch class of drugs each time we're administering these. So I want you guys to know bactericidal and bacteriostatic. There are distinctions from each other. Okay. What I don't care for you guys to memorize are these families of antibiotics, right? Like cephalosporins or Exceed, okay? Danaflax, X, and Danaflox, Advocin, right? Is bactericidal. Okay. Bacteriostatic would include your tilcomycins, which are nicotils and draxins. Okay. So I don't care for you to memorize which of these belong in under bactericidal or bacteriostatic, but know the two distinctions between those modes of actions. Make sense? Okay. So just wanted to throw this in here. Exceed is unique in that no other antibiotic gets administered this way. Who's administered Exceed before? Okay. Yeah, you literally inject the dose into the back of the ear. Weird. Whatever they formulated this antibiotic, it is formulated to be kind of a slow release, and it is formulated to function in that tissue, slow release those antibiotics. Okay. So you do not give Exceed sub-Q. I guess it is sub-Q. You do not give it in the neck, you give it in the ear, and it's the only one of its kind. That's a bit of a pain in the butt, too, right? Think about administering, like you have cattle to shoot, okay? Think about administering it to them in the back of the ear compared to the neck, right? So who knows what a head gate will do to an animal when they go in the sweet chute? Yeah, and they can throw their head around while you're trying to administer it. So if metaphylaxis is the mass treatment of a whole bunch of different cattle on arrival, you'd be treating a whole truckload or two. So say you're treating 120 with, I don't even know if Exceed is approved to be used for metaphylaxis, but would you want to use Exceed, inject all of them in the back of the ear? Not unless, yeah. So just something to think about. The other thing that I would point out is Nuflor. Who's ever used Nuflor? How would you describe Nuflor?
Like this backup or like a secondary
Mm.
like this second.
Yep. It's real thick. So if you're working cattle, treating cattle, and it's cold outside, it could be a pain in the butt. It can slow you down. They actually sell heaters for Nuflor specifically because it's like you'd be like injecting cane syrup. Cane syrup. What am I trying to say? Molasses. Okay. All right. Classes of antimicrobials. You guys do not need to memorize these. Okay, but we have our macrolides, so tolframycin, Draxin, uh, filmicocin, Micatil. Okay, you have cephalosporins. Okay, so that's your CD4 and your cephalosporin. So CD4 is Exceed, which we just talked about, one that gets injected in the ear. Okay, and phenycols. So you have fluorphenicol, which is Nuflor, uh, and then fluorphenicol again, which is Resflor Gold. So what is special about Resflor Gold? Does anybody know?
And then what made it?
It's an NSAID. I don't know if it's specifically Banamine, but it has an NSAID. Why would we want to give a non-steroidal anti-inflammatory drug in an antibiotic? So what are other NSAIDs that we take?
Um,
Tylenol, ibuprofen. If you are sick, why would you take Tylenol or
Make you feel
suppress
better.
your fever? So it makes you feel better. So maybe you can go and eat. Okay. So this fluorphenicol, this Resvor Gold, actually has an NSAID in it, which is supposed to suppress fever. Okay. Why might that be a bad thing?
Suppress the signs.
Yeah, but it also suppresses your body's natural means of dealing with these viruses, right? By suppressing fever or the febrile response, could suppress the innate immunity's ability to cope with the disease. So there's actually quite a bit of research that shows that it's not good. Okay. Quinolones and fluoroquinolones. Okay, so Advocin, Baytril, Pradilex is, I think, the newest FDA approved antibiotic for the treatment of BRD. Never used that. Then you have your tetracyclines, so Oxytet, so biomycin, and then LA200, LA300. Okay. Okay, these are the drugs that are approved to be fed, or excuse me, not fed, used for mass med, so metaphylaxis. We kind of talked a little, just briefly, about metaphylaxis. I think I mentioned it in class the other day. And we defined it today. So what would be a situation where we want to use metaphylaxis?
Find a bunch of catalog, a bunch of different cell lines.
So let's think about risk classification. What risk classification of cattle? Yep. Maybe if I'm buying some high risk exposed cattle, some cattle that have been in the auction market for a long time, they're going to have suppressed immunity. We know chances are they're going to have a real high increase or incidence of BRD. Maybe we want to metaflex them. Okay. So we have tolframycin, which is Draxin. It's a macrolide. Filmicocin, I think, is Micatil. You have some of your CD4s, oxytetracycline or phenycols. Okay, so you have all these that are approved for mass med of cattle. Okay, this meta-analysis looked at 37 different studies, and they concluded that macrolides, so Draxin and Micatil, are the most effective for metaphylaxis. After that, you have your third generation of cephalosporins, which are I think Exceed. Yeah, Exceed and Exenil. Okay. All right. So if I ask you which class of antibiotic is most effective for metaphylaxis, say macrolides. Okay. So here's an example of a treatment protocol that I've done in the past. Okay. So in this one, we have 3 strikes and you're out. Okay. So for first pull, we're going to pull cattle that have superiority score of mild to moderate, so 1s and 2s. We're going to rectal temperature them. We'll treat anything that is over 104. Anything that is under 104 will return to the pen. Anything that has a clinical illness score of 3 or 4, we're going to treat no matter what. Okay. Our first treatment antibiotic that we're going to use is Mycotil. Okay. We're going to deliver this at 1.5 milliliters per 100 pounds. Give it sub-Q in the neck. Okay. Importantly, this drug, Mycotil, is a macrolide and it's a bacteriostatic. Okay. So note that for when we go to the next protocol. Okay. So we're going to reevaluate this animal at 120 hours. He is not eligible to receive treatment again for 5 days. Then you can have some clauses, right? So if I identify this animal as a clinical illness score of 3 or 4, I'm going to treat him again as early as 72 hours if he's a 3 and a 4. Okay? Does that make sense? What you'll find is these treatment protocols are very well regimented. Okay? And most of the time, a manager is going to set these up with their veterinarian. Okay? Okay. Second pull. It's been at least 120 hours since the last treatment. The severity score is mild or moderate, so 1 and 2. Rectal temperature, the threshold is 104 again. So this time we're going to give them Advocin. Okay, Advocin's dose is 2 milliliters per hundredweight, sub-Q in the neck. So Advocin is a quinolone / fluoroquinolone, and it's bactericidal. So you notice how we switched classes of drugs between that first and second pull. Okay. So now he's not going to be eligible to treat again for 4 days, so 96 hours. Okay. However, if they are scored a 3 or 4, so they have a clinical illness score that's severe or greater, we may treat them in as early as 48 hours after the second treatment. Okay. Any questions?
Why wouldn't you just use the bactericide versus using bactericide?
Why would I not want to use bactericidal versus bacteriostatic as a first treatment? Bacteriostatics appear, especially your Draxxin and your Mycotil, appear to be the most effective. That's also why they were the most effective metaphylaxis. But you want to switch class during your second pull so you can broaden your spectrum. Yeah. But I would typically always recommend, and some protocols may do, this is just an example of one, right? Some protocols may do a bactericidal first and switch to bacteriostatic, especially if they mass medicated with a bacterial static. So if I mass medicated metaphylaxis treatment with a bacterial static, Draxxin or Mycotil, then that next time, that first pull, I may do bactericidal first. Make sense? Okay. Oh, here's a good point of discussion. Why might I not want to mass med a bunch of animals with Mycotil? I think you've got to inject yourself with an appreciable amount, but it has been linked to heart attacks in humans. Someone accidentally injected themselves and they died. I think there may be a couple of cases. So maybe it's not a good drug if you want, it's cheaper than Draxxin, right? But maybe it's not a good drug to mass med everybody. You're going to be handling a lot. Okay. All right. Third pull. This is that last chance for that animal to recover. Okay. They're eligible 4 days after the first pull. Okay. We're going to pull 1s and 2s. We're going to rectal temp them. This time we're going to give them Exceed, 1.5 milliliters per hundredweight, sub-Q in the ear or the base of the ear. Okay. So Exceed is bactericidal and ceftioflor. So we changed class of drug again. That makes sense? So you want to switch between bactericidal and bacteriostatic. but you also want to change between actual class of the drug. So I don't want to reintroduce, if I gave Micatil for the first pull, I don't want to introduce another macrolide in this treatment protocol. We're trying to broaden the spectrum. Does that make sense? Okay. Then, okay, if they're a 3 and a 4, we're going to treat them no matter what. Okay. Here's another example of a protocol. Okay. First pull, we're going to, so slightly ill or higher, so 1 and higher, we're going to bring them in, we're going to rectal temperature them. This time we're going to lead off with Baytril, okay, 5.7 milliliters per 100 weight. It's going to be sub-Q in the neck. Baytril is bactericidal and quinolone and fluoroquinolone, okay. Now we're not going to give them any more treatment for 48 hours. If they're 3 or greater, we'll treat them no matter what their rectal temperature is. Second pull, it's going to be at least 2 days since last treatment. We're going to pull in temps 1s or greater. Draxin this time, 1.1 milliliters per 100 weight. So Draxin is bacteriostatic and a macrolide. So in that first example, we went bacteriostatic, bactericidal, bacteriostatic. Okay, this time we're going bactericidal for a first pull, bacteriostatic for a second. Okay, then we're going to give them no further treatment for 5 days. Okay. Third pull, it's going to be at least, in this protocol, at least 5 days since last treatment. Ones and greater, we're going to pull and rectal temp. This time we're going to use XNL, 2 milliliters per 100 weight. XNL is bactericidal, and it's ceftioflurane. Okay. Then we can repeat this treatment in 48 hours. We will repeat this treatment in 48 hours, regardless of severity score or temperature. That's something unique with XNL is that they want you to re-administer it after 48 hours. Okay, this protocol has 4 pulls. This is our last chance pull. Can be at least 96 hours since last treated. Again, 1s and graders, we're going to pull in rectal temp. We'll treat 3s and 4s no matter what. This time we're going to use biomycin 200. That's 4.5 milliliters per 100 weight. Sub-Q in the neck. It's bacteriostatic, and it's an oxytetracycline. Okay. So with 4.5 mils per 100 weight, what's 4.5 times 600 for 6? We had a 600-pound steer, like 24 or something. Okay, that's a lot. According to BQA, how many milliliters can you inject in one injection site? 10. So you'd want to use at least 3 injection sites for this one. Okay, so just something to keep in mind. Okay. My personal thoughts, always start with a macrolide, then use a bactericidal, always change classes between pools so that we can broaden our spectrum. You have to keep adequate treatment records on an individual basis because you need to know what was the last drug I gave them, how many days until they're eligible to be treated again. Does that make sense? You can't do this off vibes, right? Okay. You want to also track their history of a clinical illness score. So even if they're not being treated, you want records of, I pulled them and temped them this day, they had a clinical illness score of this. So you can see if they're kind of progressing. Make sense? And you have to track withdrawal times of these antibiotics in case you need to rail or realize this animal. What does that mean? If I say rail, I'm going to rail or realize this chronic steer. Okay, so I have this animal, has a problem being sick, got done with its withdrawal time. I want to just send it to the packing plant and get what I can get for it so I can recoup some of my money that I spent into it. Okay, so that's real life or really sick cattle, chronics. You want to realize. Okay. I actually know of a guy who has a kind of a small feedlot. He will buy these realizers from other feedlots, and he may pay 50 cents a pound for something crazy. And then if they live, they live. Maybe he can carry them out through finish and then take them to the packing plant, make a boatload of money, or otherwise he's not out just a whole lot, right? So know of a guy that does that. I don't think I would want to do that, but okay. Um, okay, but to be able to rail or realize these animals, you need to know when they're eligible to be harvested. Okay, any questions? Okay. So one thought that could come to your mind is why don't we use combination therapy? So why don't we give multiple drug classes at the same time so that initial treatment broadens the spectrum of activity, okay? So some perceived benefits. Do we think that one drug is good enough, right? So maybe I should administer 2 shots, akimbo style, right to their neck, right? Treat them at the same time, broaden my spectrum off the bat, okay? So we have tested this. They showed no benefits to response rate, relapse rate, and mortality. And it increased your costs, right? Because now you're $26 into an animal at its first treatment as opposed to 13. Okay. And then some combinations can actually interfere with each other. Okay, so some bacteriostatic may interfere with bactericidal drugs and vice versa. Okay. All right, here's where I define metaphylaxis. So it's a treatment given to animals experiencing any level of viral or bacterial disease before the clinical signs appear. So mass treating a whole group of animals. Okay. It is a therapeutic option, not a treatment option. Okay. It's appropriate for selected groups of stocker/feeder cattle. So you're high risk exposed, or maybe you want to do it for your high risk cattle. Okay. So a DVM out of Kansas State, he said, use metaphylaxis when the expected risk of BRD falls into a high risk category. So that means you're expecting 30 to 50% mortality. Is expected to have morbidity signs, and when expected mortality will be 2% or greater. Okay. All right. So when I'm doing a metaphylaxis program, my objective is to reduce morbidity. I want to reduce the number of cattle that get clinically ill with BRD. Okay. I want to reduce mortality. If I can make these animals feel better quicker, I hope to improve performance. So you can't really justify the cost of metaphylaxis without some level of increased average daily gain. Okay. It's a benefit for facility management. So can I reduce the amount of crowding that's happening in my hospital/sick pens? So what is a hospital pen? What's that? Yep. So you may have an animal that clinical illness score of 3, first pull, you pull them, and you think that you're going to be pulling them again in a few days. You don't want to make them walk all the way from the processing barn back to his home pen. So you may place them in a hospital pen that's close to your processing facility to relieve stress off that animal, help them to recover. Also makes it easier for pen riders, makes it easier for you to keep an eye on them, right? So typically you'll put some kind of like chronics, those that are kind of chronically sick. Okay, another benefit, you can overcome personnel shortages and then inexperience, right? It's a kind of a work of art. It's a subjective scoring system. So these pen writers or the managers that are identifying sick animal, some are going to be better than others, right? It all comes with experience. But if we can decrease the amount of BRD cases, you can decrease the labor that are being applied to the manager or the pen writer in terms of how many head they're running through the processing chute pulling from pens, running to the processing facility, and treating each time. Make sense? Okay. With fewer cattle becoming clinically ill, you decrease your chances of having missed pulls. Okay, so that's a missed pull would be you had a pen writer out there was an animal actually sick, and he didn't identify the pull. Okay. And at the end of the day, you don't want to do metaphylaxis unless it's going to improve profits. Okay. All right. We're going to finish up with a few other diseases. Okay. First, pink eye. Who has seen an animal with pink eye? Okay. Is it exactly what it sounds like? They have a pink eye. Could also have a little scar, like a white eye. Okay. So it's also referred to as infectious bovine keratoconjunctivitis. Okay, so conjunctivitis is what? Like the infection in the eye, inflammation of the eye. Yep, absolutely. So if I ask you what is the common name for bovine keratoconjunctivitis, you would say pink eye. Okay, all cattle are susceptible, and this can happen year round. Okay, but younger animals are typically more susceptible than older. Okay, calves that are born to younger cows or older cows have increased incidence. Don't know why, but it could be with either a lack of experience on mothering, right? They bed them down someplace with a lot of flies. And then on the older cow spectrum, they just don't have the energy to be good mothers, maybe. Okay. Bull calves have greater incidence and severity than heifer calves. Don't know why. Okay. Here's some pictures of pink eye. So you can see that one on the top right has scarred over. So that may be an older case of pink eye. The bottom right would be kind of very clinical and probably relatively early, maybe. Okay. So what causes pink eye? It is Moraxella bovis, Moraxella bronhamella ovis, Mycoplasma genus of bacteria, and BHV1, which is red nose virus. BHV1 is another word for infectious bovine rhinotracheitis. Okay. So that's bovine herpes virus 1. Okay. So things that are involved in the development of pink eye, irritants, dust, different plants that may have like little barley. You know what little barley is? They have these seed heads that are kind of relatively small and kind of sharp. So they're notorious for causing pink eye if they get a little bit of that seed in their eye and it causes a wound of some degree. Okay. And then face fly is probably the most notorious. So there's the scientific name for face fly. So face fly, around that, Herefords are more susceptible to having face fly issues compared to Angus or other species. Why might that be? Yeah, absolutely. I think they just make a better target for those animals, for the flies to identify where to go. Okay. Pink eye control. Okay, so if flies cause pink eye, one way we can control pink eye is to implement fly control. So that could be fly tags in the cattle, or porons, keeping areas clean, right? Then injectable antibiotics. So these oxytetracyclines are probably my go-to for the treatment of pink eye. Okay, there's also topical antibiotics. So it'd be like an antibiotic powder you can put directly on the eye. I've heard of people actually putting those on the eye and like sewing a eye patch around it. Never done that. You can suture the eyelid. Okay. You can vaccinate against that Marexella species of bacteria, and then BHV1. Okay. Then you can also inject different antibiotics directly into the eye. I've never done that. Okay. Any questions? Coccidiosis. Okay. These are the two main coccidiosis bacteria. You have your Eimera bovis, Eimera zurinae. Okay, these are host specific. They're transmitted through fecal oral. So you have an animal that's grazing on pasture and it consumes a plant that has fecal contamination on it. Okay, or you have an animal in a feedlot and one sign of stress is eating manure. Maybe they've ingested that coccidiosis or coccidiosis through that. Most cattle will have coccidiosis. However, you don't really see it become clinical until that animal gets stressed. So this is kind of my perception as not a veterinarian, so take it for what it's worth. I think that the best way you can protect against coccidiosis is to just decrease the amount of stress these animals experience. Okay. Okay. Calves nursing dams. So maybe they've ingested some feces through when they're suckling. So maybe the dam laid and got manure feces on their udder. So they ingest that while they're nursing. Grazing stocker cattle can be affected if they're consuming feces off of the pasture. And the concern on a feedlot sense is when you're buying cattle that already have this coccidiosis. Okay. Clinical signs, so kind of non-specific depression, so decreased appetite and loose stools. Probably the number one way you identify an animal that has coccidiosis would be by bloody stools. Okay. Okay. Since they are losing blood, they can become anemic, right? So every time they poop, they lose blood and become anemic. You can see that in pale mucous membranes around the mouth and eyelids, severe dehydration, big time weight loss, straying to pass stools, which is called tenesmus, where you pre-vet people, tenesmus. Possible blood clots, pieces of intestinal lining being excreted in their feces. So that's called mucosal casts. And then ultimately it can lead to death. Okay. Treatment, you can have treatment with amprolim. So commercial name is Corid. There's a lot of different routes you can get Corid into an animal. There's an oral drench. You can feed it to them through a powder that you mix in their ration. You can offer it to them in their water. Okay. Prevention, chiefly ionophores, namely monensin, which trade name rumensin. But getting an animal to consistently consume ionophores, especially on pasture, can be very difficult because most of that time it's coming through a loose mineral. But actually, ionophores started out as a coccidiostat for chickens. Someone took that rumensin that had been used in chickens as a coccidiostat, fed it to animals, and saw that improved average daily gain. Okay. Another prevention is decox, and like I said, reduce stress, minimize contamination of environment. So maybe you want to, if you have a problem with coccidiosis, maybe you want to have lower stock density, so you're not forcing animals to eat so close to the ground where the risk of picking up this coccidiosis through fecal contamination is less, as an example. Okay, moving on. Foot rot. So a lot of different names for foot rot. Foot rot's a common name. Interdigital phlegmon. interdigital dermatitis, interdigital necrobacillosis, infection pododermatitis, and then foul in the foot. Okay. The primary bacteria, and so if I ask you what's the primary bacteria for foot rot in cattle, or maybe actually more likely, I will say Fusobacterium necrophorum is a primary bacteria for what illness? Okay. The answer would be foot rot. Also liver abscesses, but we'll talk about that later. Okay. Any questions? Okay. Treatment of foot rot. So you see an animal limping, you pull them into the chute, you tie up their hoof, pull it up, you clean the side, you smell it, and it smells god awful. That's how you would typically diagnose foot rot. Okay. Okay. It smells like rotting flesh. Okay. But antimicrobials, so several are labeled for treating foot rot. I'm just have LA300 here as an example. Okay. Feeding EDDI, so that's ethylene diamine dihydroiodide. That is the common source for us to bring iodine into the diet. But cattle that have more EDDI in their diet, more iodine in their diet, have less incidence of foot rot. Okay. Any questions? Okay, clostridial diseases. They are classified by the species that causes them, and each of these species has a different predilection site. Okay, so predilection site just means where they want to go in the body to cause maintenance. Okay. Okay. So, for example, Clostridium shoveli, okay, is blackleg. So when someone says they vaccinate for blackleg, really they're vaccinating for a whole family of Clostridia diseases, but just colloquially we refer to it as blackleg. So the predilection site for this Clostridium shoveli is in skeletal muscle. So, etiology. Animal ingests the spore of this Clostridial bacteria. That spore migrates into its predilection site, wants to go to the skeletal muscle. Once it goes to the skeletal muscle, it causes muscle damage. Those spores germinate. And then when those spores germinate, it produces toxins. Okay. Septicum is malignant edema or gas gangrene. Again, its predilection site is in skeletal muscle. Then you have Clostridium sordeli. Okay, it's not as common. Isolated malignant edema cases. Okay, Clostridium novi type B, referred to as black disease. Its predilection site is the liver. So again, animal ingests the spores of this Clostridium. Those spores seed in the liver, causes damage to the liver. Spores germinate, produces toxins, and then ultimately it causes fluid buildup in tissues. And we have novi type D. Okay, this is red water disease. Predilection site is again the liver. So toxins are produced, intravascular hemolysis. Okay, so that causes red blood cells to burst and release hemoglobin. Then that causes hemoglobin urea, which is hemoglobin in the urine. So bloody urine. Okay. Because it inhibits hemoglobin, we have decreased oxygen that's able to be transported across or throughout the body, and it will ultimately lead to death. Okay. Then you have your perfringens, okay, type C, typically only really affects younger animals. So ingest the spore. Spore goes to its pre-elution site, produces the toxins. Here it causes cell death, damages absorbent lining of the intestine, causes bloody inflammation of the intestinal tract. Parafrenogens type D. This affects older animals. These animals will exhibit neurological signs. So what are neurological signs?
Brain, yes, it'd be like maybe equal to.
Yeah, crazy motor behavior, right? Most neurological signs people refer to as brainers. They'll just kind of walk, act, and function all weird. Okay, so this perfringens type D, referred to as enterotoxemia, pulpy kidney disease, overeating disease, characterized by diarrhea, convulsions, paralysis, and eventually rapid death. Okay. They will exhibit these signs typically after like a rapid diet change. Okay, Clostridium tetani. So everyone's heard of tetanus. Okay, so that's what this is. God bless. Getting tired of talking. Okay, can cause lockjaw, affects the nervous system. Okay, inhibits normal nerve functions, blocks normal inhibitory nervous transmissions, causes muscle spasms, tetanic spasms. Okay, just like with humans, this is going to be increased when there's wounds from rusty nails, right? Castration, pus in the uterus, tail docking for sheep. So anytime we cause a wound that kind of exposes that wound to the environment. Okay, clinical signs. So bloat, because it has this effect on the nervous system, it inhibits normal rumen function. So they're unable to rotate gas, so it can cause bloat buildup in the rumen. Stiff gait or sawhorse stance. So that top picture there on the top right, where that top picture there is a sawhorse stance, which is a clinical sign of tetanus. So they'll get what's called prolapse of the third eye. So this nictitating membrane. So that's that bottom picture there. Twitching ears, death due to low oxygen in blood, and heart failure, all related to the suppressed nervous function. Okay. So these are the bacteria that are commonly treated whenever we provide clostridial vaccines. Don't really care for you guys to know all those. Okay. But for example, Ultrabac 8 is an 8-way clostridial vaccine against those clostridial species. Okay. Any questions on clostridiums? Okay, we're done, guys.